that's working height. Okay? I'm going to put the side rail down on my side. I've done all the procedure checklist. Okay? And now I'm going to position my patient in what is called a left side or Sims position. So he's on his left side, not on his right side, and I'll explain that in a little bit. But he's on his right side, okay? I mean left side, sorry, left side. And this top leg here, I want him to try and bend it up as high towards his chest as he can. This patient is not going to help me very much, okay? All right, so he's on his left side. This top leg is all the way up towards the chest as much as possible. I'm going to take a blue chuck and just put it right underneath his buttocks, right here, okay? And then I'm also going to get a bedpan, and I'll talk about the bedpan in a little bit. And I'm just going to keep that by my patient. I'm going to get some gloves because this is a clean procedure. It's not a sterile procedure. The first thing I'm going to do is I'm going to make sure I'm going to fill up my bag with as much water as the doctor has ordered. So this cleansing enema bag you get out of the supply closet, okay? You get it out. There are different kinds. I don't know if this exact kind, I highly doubt this exact kind is going to be at your facility, all right? But it will always say cleansing enema bag kit on there. So you get that out. There is actually a pad here. If you don't have a blue chuck, you can always use this pad, okay? It doesn't matter. All right, so then here's the bag right here. All right, and it has, so the bag has there's an opening on the top right here, and then there is tubing on the other end, and then there's usually the cap. Now this particular bag, inside the cap is water-soluble lubricant already, so it's actually pre-lubricated, okay? But if I were you, I will never ding you if you want to apply more. Trust me when I say you might want more. All right, and then there is a clamp, all right? So the first thing that you do when you get this out of the bag is you want to make sure that the clamp is pinching off the tube, just like that, okay? And then the second thing you're going to do, you're going to go over to the sink that's in the patient's room, and then you're going to open up the top, and you're going to get warm water. I don't know, there's even a temperature that the book states. I think it's like 105, 110, whatever. If it's warm on your arm, then it's warm enough to be in his rectum. Okay? So you're going to open this, up, and then you're going to fill this up to whatever the doctor wants. Say that he wants it to 500. On this particular bag, right on the edge, it is marked 500, 1,000. This one actually says 1,500, okay? So you want to fill it up to the 500 mark. Once it's filled up to the 500 mark of warm water, then there is a packet of glycerin soap, Castile soap, okay? I'm sorry, I said glycerin. Castile soap. Open this up and pour this into the bag, all right? Shake the bag up a little bit, and then you're going to go over to the sink, and then you're going to what's called priming this tubing. Now this tube is filled with air. You don't want air into your patient because it's going to come back out. All right, so you're going to hover over the sink and you're going to unclamp and let that warm soapy water from the bag flow into this tube and then out the other side. And you just want to clear the air. Once the air is all cleared, go ahead and clamp it back. All right? Is everybody with me so far? Mm-hmm. All right. Once it's there, then I'm going to go ahead and I can tell my patient, okay, here comes the tube, because he knows what's about to happen. So I usually will take extra lubricant, okay, and about 3 to 4 inches again of this lubricant is
do they come in different sizes?
No.
This one.
They do for kids. Kids always have a smaller size. Okay? All right? So, I can't remember what your book says. I can't remember if it's 2 to 3 inches or 3 to 4 inches. I think it's 2 to 3. But correct me if I'm wrong. It's in your notes. All right? And then I'm going to go into his rectum, and I'm just going to tell him, I want you to relax. Take some slow, deep breaths, and you're going to go in. This is something that you just don't shove. Okay, so gently insert it into the rectum. Okay, tell him to relax. Okay, the whole thing doesn't go in, y'all. I'd say about 3 inches goes in. All right? Once he has that in, tell him to relax. You're going to put this bag at hip level at first. Hip level. Okay? You're going to unclamp. And then you're going to let this water, warm, soapy water, flow. Okay? Now, he is probably going to feel that warm water. He's going to be a lot. If he's cramping, then clamp it. Give him time to recover a little bit. Lower the bag even a little bit more, and then unclamp it. All right? The lower this bag is, the slower the flow goes into him. Does that make sense? Because sometimes that cramping, it's because you're infusing it in him too fast. So if you start slow, you'll be okay. Now let's say we're at hip level, and about, I'd say 30 seconds go by. He's actually tolerating it very well. Then go ahead, you could be here all day, especially with 500 cc's. So go ahead and lift up anywhere from 12 to 18 inches, or a foot to a foot and a half. So what are we doing?
Infusing it faster.
We're increasing the rate of flow, right? And then what we could do is, if you have an IV pole that's at that exact same height, you can actually leave it there, because it's still slow enough. It's just a little bit faster, right? And let that all flow in. Now this is something where you just don't up and leave, okay? You actually will stay here, okay? And so let it all flow in. He's still breathing. He's still trying to relax. Okay. I will tell you that in the times I have done this on real patients, some patients, depending on how full they are of feces, they may not tolerate the full 500. And you will know that if they really start cramping. Really start cramping, no matter what level that bag is. Once that, let's say that all 500 cc's does go in, then you go ahead and clamp it before you take the tube out. Let me say that again. Clamp it before you take the tube out, okay? You're going to take this tube out, all right? I would wrap it around, if you have this top sheet, I would wrap it around this. This goes in biohazard, right? And then you're going to go ahead, if your patient is bedridden, put them on a bedpan. To put on a patient's bedpan, remember, this wide side goes on their buttocks. This narrow side is what's in between their legs, not the other way around, okay? So this way. So if they are able to get up, I would go ahead and get a bedside commode right by them. Because when they're ready to go, they're ready to go, okay? So we're going to help our patient onto a bedpan. And now, if our patient is bedridden, can he defecate laying flat?
No.
No. So put his head up, I would say about Fowler's position. So about 45, 60 degrees, okay? However he can handle it. Now, this is something, it may take a couple of minutes, and actually you want your patient, you definitely want to tell your patient, I want you to try and hold this enema in for 5 to 10 minutes. Okay? Now, I'm here to tell you, there is no stinking way that he is going to last 5 to 10 minutes. Okay? I've never seen a patient that lasts 5 to 10 minutes of holding a cleansing enema. Okay? But you definitely want to give him some privacy. So, before I leave, I'm going to give him his call light. I'm going to actually put it in his hand. I'll say, Mr. Mannequin, I want you to try and hold this for 5 to 10 minutes. Okay? Take my gloves off. I'm going to wash my hands. I'm going to leave, but this is not where you go.